would say to my friend from Utah that he has made over the course of the last year, has made many compelling arguments about the substance of this legislation, and just now described, I think, at least summarized what some of those are. And I think the reason that the American people have rejected this legislation is they understand the substance of it. As the senator from Utah pointed out, it's got tax increases, it's got Medicare cuts, and it's got premium increases for most Americans. They figured that out a long time ago. And that's why I think if you look at the public opinion surveys that have been done with regard to the bill itself and to the process by which we have gotten to where we are, the American people are rejecting it. The reconciliation process, which has been talked about, is a way in which to ultimately pass this through the House and then through the Senate. There have been polls that have asked the American public what they think of using reconciliation to enact health care reform. Gallup poll from February 25th, 52% of the Americans oppose the use of reconciliation. Last week's Rasmussen Reports poll shows that 53% of Americans are opposed to the health care plan. Perhaps the most telling poll is the CNN poll from February 24th, if you can believe this, that says that 48% of Americans want Congress to start working on a new bill. And 25% of Americans want Congress to stop working on health care. Now, added together, that is 73% of the American public that wants Congress to either stop working on health care altogether or start over. Now, I'm not among those who thinks that we ought to stop working on this. This is a big, important issue to the American people. They want us to do it, but they want us to get it right. And what's being proposed by our colleagues on the other side, and what's so far been rammed through here on a very partisan basis, is a $2.5 trillion expansion of the federal government that expands the health care entitlement, but does very little to reform health care in this country or to address the underlying drivers of health care costs in this country. And so the senator from Utah is absolutely right in why it describes, I think, why the American people are so opposed to this legislation, and that is because they understand it. They know what it does. And they're concerned about the cost of their health care insurance in this country. They are concerned as well about those who don't have health care, and we have come up with solutions that we think make more sense to cover those who don't have coverage. But I think it's pretty clear where the American people come down on this issue. And incidentally, I think that's also what many of these elections we've had recently are about. If you look at what happened in Virginia, New Jersey, most recently in Massachusetts, many of those were referendums, if you sort of go inside the numbers, on the health care issue. And I think it's a clear message to Washington that these health care proposals are not acceptable to the American people. And yet it doesn't seem that those of us here in Washington, D.C., or at least some of us, are listening to that message. And frankly, I believe, Mr. President, and I would say to my colleague from Utah, this is a bad bill that has been rejected by the American people, part of it because of the substance of it, part of it because the normal process hasn't been followed. And we all know what was done to get that extra vote to try and pass this thing through the Senate, to get that 60th vote, all these backroom deals that were put together at the last minute. We've heard the Cornhusker kickback chronicled. We've heard the Louisiana Purchase chronicled many times over the course of the last several months. But I think the point very simply, and I would say to my friend from Utah, is that one, the American people understand that this will lead to higher cost for most Americans. It's going to increase their cost of health insurance in this country. Two, they want to see a bill that is put together in a way that elicits bipartisan support. The senator from Utah has been here since 1977, has been involved in a whole series of important bipartisan debates where important legislation was acted on here in the United States Senate, but it was done in a way that had support from both Republicans and Democrats. And I think that's what the American people expect of this process. And they also expect for us to conduct ourselves in a way that is transparent. And doing legislation, 2,700-page bills behind closed doors, adding last-minute backroom deals to try and get that elusive 60th vote to pass it, and now using reconciliation, something that clearly was not designed for this process, I think is another issue that is even worsening the American public's opinion, not only of the substance of this legislation, but also the process. And I want to ask my colleague about reconciliation, but before I do that, I want to mention one thing, because many of us, you and I both, and others on our side, have talked a lot during the course of this debate about the cost and what we ought to be doing to address health care. And if we want to address health care in this country for most Americans, or reform health care, it means getting costs under control. We've been arguing for some time that most Americans, and I think it's been through the Congressional Budget Office has validated this, the actuary for the Center for Medicare and Medicaid Services has validated this, that if you are buying in the individual market, you're going to see your insurance premiums go up above what they would normally go up, 10 to 13%. And if you're someone who buys in the large employer or small employer market, you're still going to see your health insurance premiums go up. They're going to be going up at the rate they are today, or maybe slightly higher, but the rate they're going up today is twice the rate of inflation. And the senator from Illinois, the distinguished whip on the majority, the Democrat whip, said yesterday on the floor of the Senate, and I quote, "Anyone who would stand before you and say, well, if you pass health care reform, next year's health care premiums are going down, I don't think is telling the truth. I think it is likely they would go up, but what we're trying to do is slow the rate of increase." End quote. So there you have it. We've been saying this all along, an acknowledgement by folks on the other side who are finally saying or reiterating what we've been saying all along, and that is that health insurance premiums are going to go up. And I think if you're someone who, like I said, who buys the individual marketplace, who is in the large employer or the small employer market, you're going to see your premiums go up. The question is how much. And I think for most Americans, they're going to go up significantly. But I would say to my colleague, and I would ask him, because he has been here since reconciliation almost was put in place. You have to go back to 1974 in the Budget Act, but I'm told that it's been used 18 or 19 times since then. And since the senator came here in 1977, I think every time reconciliation has been used, you have been a part of that process and have had to vote on that. And there probably isn't anybody in this chamber that's more experienced on the issue of reconciliation, what it was designed to do, what it can't do, than is the senator from Utah. And so I would ask the senator if he could explain to those of us who haven't been here as long exactly what reconciliation was designed to be used for, how it's designed to function, and why it is not applicable to the case of trying to restructure or reorder literally 1/6 of the American economy, which is what health care represents in this country. I would ask my friend.
Well, I think
it's interesting how the semantics and terminology changes in Washington depending upon what point you're trying to make, but many of our colleagues who have weighed in heavily against the use of reconciliation on a range of subjects, more specifically now health care reform, are now referring to it as simply a simple majority. All we're asking for is a simple majority vote, which does represent spin and misdirection. Because as the senator from Utah has noted, reconciliation as a procedure has a fairly special place in the history of the Senate going back to 74 when it was created. And it's to be used for specific purposes, to reconcile spending, revenues, tax increases, tax cuts, primarily to accomplish deficit reduction. And as the senator from Utah has pointed out, when it's used to enact significant legislation, generally has broad bipartisan support. You mentioned welfare reform, had 78 votes for it. That's the most frequently cited example of use of reconciliation for something that was policy-oriented. But remember, that had 78 votes here in the United States Senate. A huge and decisive majority of senators decided to vote for its use in that case. You also have, as I said, other examples where it was done to accomplish reducing taxes, increasing taxes. Those are all arguably legitimate uses under the procedure of reconciliation. But now what you're finding is legislation that literally would restructure and reorder 1/6 of the American economy, that would have profound consequences and profound impact on the American people for not only the near term but the long term. We're talking about using this go your own way, go it alone process of reconciliation simply because using regular order cannot accomplish the objective that is desired by the Democrat majority. So they've fallen back on the use of reconciliation for something that really is unprecedented. And it's interesting to me, if you look at historically what some of our colleagues have said, the person who's probably, there aren't many people who have more experience with this issue or more experience in the Senate than the senator from Utah, but the senator from West Virginia, a member of the Democratic majority, has been here for even longer. and is cited most often as being the author of the current budget process that we have, which includes this reconciliation procedure. And he wrote a letter a year ago, which I would like to submit for the record, and I want to quote the first paragraph from that letter. A year ago in April, he said, "Dear colleague, I oppose using the budget reconciliation process to pass health care reform and climate change legislation. Such a proposal would violate the intent and spirit of the budget process and do serious injury to the constitutional role of the Senate." That is what the author of reconciliation said a year ago about trying to do health care reform through this process that the majority has decided to use. Now, there are lots of other examples of our colleagues in the Senate on the other side of the aisle, and I could go on and on. Majority Leader Senator Reid in November of 2009 said, I quote, "I'm not using reconciliation," end quote. Senator Conrad, who's the chairman of the Budget Committee in the Senate in March 2009, on the floor said, "I don't believe reconciliation was ever intended for the purpose of writing this kind of substantive reform legislation such as health care reform," end quote. And you even go on, the president, when he was a Senator at that time Obama, and now president, said reconciliation's a bad idea. So, you go on, and you can find these statements of our colleagues on the other side who, in the past, have expressed opposition, and not just tepid opposition, but I would argue very aggressive opposition to the use of reconciliation for something this consequential, and are now sort of falling back. In fact, we've got 18 Democrats on the record who have said they oppose the use of reconciliation, who are now saying that we think that this can be used for this purpose, and now it's being referred to as a simple majority. And so, again, I would say to my colleague from Utah that I think the spin that's going on now to try and again confuse the American people about what is happening here is something that we need to end. We need to be transparent and clear with the American people about what's being done here, and I would simply ask my colleague from Utah whether he thinks either the process of using reconciliation, the processes that led us up to this point, or for that matter, the underlying substance of this bill is something that the American people would be proud of and would want to see us pass here in the United States Senate.
Happy to yield.
Just one final point, because I think it's an important one, and I've heard it articulated by our colleagues on the other side, and that is this whole process by which the House is acting on this legislation. I served for 3 terms in the House of Representatives. I know I still have colleagues, friends over there, and I know that they have a way through the rules process of doing a lot of things that aren't allowed for in the Senate. The Senate, of course, was designed by our founders to be more free-flowing, to slow things down, and to be more deliberative. The Rules Committee allows them to put together what they call a self-enacting, self-executing rule, and essentially what you said is to deem as passed the Senate bill without a roll call vote or without a recorded vote on it, which tells you right there that there are a lot of House members who don't want to vote on the Senate-passed bill. They don't want to go on the record on it, and the only way that bill can pass in the House of Representatives is with an accompanying reconciliation vehicle that makes the fixes that most of those House members want made. My point simply is this: health care reform cannot pass absent this reconciliation process that's being promised on the House side, and also being promised to House members that if they vote for it over there, the Senate will follow suit. I believe that the Senate, in all the points of order that will lie against this legislation when it comes to the Senate, in all likelihood that the House members are being asked to take an incredible leap of faith that the Senate's going to be able to retain many of the provisions that they add to the reconciliation bill in the House. But the point, and I come back to the dialogue you had with the senator from West Virginia, because I think it's an interesting point of discussion, and one, a criticism I've heard from our colleagues on the other side. But frankly, the House of Representatives could not pass health care reform absent this reconciliation vehicle. So it is about 1/6 of our economy. It is about reordering and restructuring literally something that is personal and important to every American. And when you're talking about doing issues of that consequence and that impact, it ought to be done, as the senator from Utah has mentioned, as has been done in the past, in a bipartisan way that elicits the best suggestions and ideas of both sides and gets a broad bipartisan vote here in the United States Senate. And I thank the senator from Utah for his leadership on this issue.
I appreciate your remarks. Sure.
I do think they have figured it out, which is which is why the last survey that I quoted was the CNN survey, which said that 48% of the people want us to start over, 25% want Congress to quit working on the issue altogether. That's literally 3/4 of Americans who have rejected the substance of this legislation, which is higher taxes, expanded government, Medicare cuts, higher premiums for most Americans, and some who flat out don't want anything done, which, as I said, is not the view I subscribe to. But 3/4 of Americans understand what this bill is about. They know how it was put together, and they've rejected both.